I'm Alicia Brooks. I am a family physician. I practice at Fort Loudoun Primary Care, and I've been there since September of 2022. The patients that I have at Fort Loudoun Primary Care vary a lot. You have some kids, I've got patients all the way down to newborns, and then I also have elderly folks who have retired to the area, who are very active and very vibrant, have a lot of life they want to live. And then I have some really complex chronically ill patients that need a lot of hands-on care, a lot of team care. I was surprised at just the range of patients that I got. I was expecting a little bit more of homogenous care, but it's been really nice to have that variety, which is part of why I love family medicine. What I enjoy about medicine, and family medicine in particular, is the relationships with my patients, but also the relationships with my staff and my colleagues. The bond of taking care of people together and doing that as a team and growing as a team and finding ways to make that better. It's exciting to me to be in a dynamic and changing environment. Primary care amongst the rest of medicine is always changing. So you have to adapt and you have to grow, and you do that with your team. And so those strong relationships amongst you and your team help you to meet those patient needs better. And so I enjoy kind of that, figuring it out, trying to make it work in a dynamic environment, and then watching as you get to have an impact on your patients every single day. And there are times that you come alongside patients when they're happy and when they're excited, and there's times when you come alongside them when they're sad and having a hard time. And doing that in the context of a good team it's a experience like no other. Residency brings so much to any medical system, because you have learners coming through that push you as a practicing doc to think more about what you're doing, how you're taking care of your patients. Is this really cutting edge, or is this just what I've been used to doing? You have to think about it. Having residents rotate through your clinic, or even just knowing that they're around and you're going to go lecture to them, is something that motivates you to be better. So it improves everybody in the system to have resident learners. Having physicians that are learners in your practice or in your system, they're always such spectacular people, and it's so interesting to learn where they came from and to get a chance to mentor and to be part of their lives and to, just to see where they go and what they want to do and who they become. So it's such a life-giving, vibrant thing to have residents as part of your system, and I'm very, very excited about having them here. Medicine's changing a lot, and there's a lot of hesitancy about being part of a big health system like CMG or like Covenant Health. I have loved being a part of a big system that has huge resources, being able to be part of somewhere that has specialists that I can refer to and get easy feedback from, hospital systems that have services that my patients need, being able to look at what the system resources are. I also see Covenant as thinking about population health a little bit more than some of our private competitors. They think about, how are we going to take care of the people that have challenges and that have difficulty getting care? And because I'm part of a bigger system, I don't have to refuse to see those patients. I get to see those patients and provide care to a broader range of patients that have more complex needs, and am able to I feel like really make a difference because I'm part of an organization that can support that. So it's really, to me, it's a unique thing to be part of a bigger organization that can support you as a physician taking care of a broad patient population and give you the tools that you need to meet their needs, whether it's specialty care or social needs or things like that. When I was in residency, I had a couple of really good mentors. One in particular was a faculty member while I was in residency in St. Louis. And he really challenged me to listen to the patient's story, to hear what was happening, and to practice with a questioning attitude. And I think having mentors that really invest in where you're at from a knowledge standpoint, but also from a personal standpoint, is really, really important. So being in a setting where you have a good mentorship program, or they have a concept of you need to have good mentors, we need to mentor you as you go through residency, I think is really important. Looking for people that you identify as, hey, I think that this person would be a good mentor for me. Even in your interview process, even as you're going through, sometimes there's a connection with somebody you interview with, or there's a feeling of, yeah, I think I could probably lean into this program and come out of this being a better doctor. I think, looking for that is helpful. That being said, first impressions are not always last impressions, so just stay open to exploring that as you go. Well, if you've been here, you know how beautiful it is. Just gorgeous surroundings, beautiful mountains, not that far away. It's an easy place to live. There's a lot of things to do without having to travel very far. And there's a lot of things for young families, which for me, that's a big deal. But also there's a lot of urban kind of nightlife and things like that for people that are looking for that. I think that this area it's just got so much to offer from just a recreation standpoint and your off time standpoint. And I think that that's important. You need to have things to do in your off time. You're not going to want to just do your job all the time. And this is a place that if you came here for residency, I could easily see people wanting to stay long term. It's definitely a great place to be. Residency and selecting a residency is a really overwhelming time in the life of a young physician or physician-to-be, but I think that you can find what you need in places here. I think there's a lot of good folks wanting to grow this program and make it a really solid residency. Really excited about what it's going to be and how it's going to grow and who the learners are going to be, and looking forward to hopefully establishing relationships with them, with community physicians, and being able to have some mentorship there too. So I think just, give us a look and see what you think.